Hey LC gang, welcome back to the Lifestyle Chats platform. It's your girl Ashley, and if you're a new subscriber, thank you so much for clicking onto this channel, and we're excited to have you guys here. But if you're a returning subscriber, the LC gang welcomes you back. So today on Gal Chats, we're going to be discussing something that I feel like you guys would not expect us to discuss, which is our teeth. And teeth is pretty much something that we all have,
Yeah.
but don't know so much about. And we have Dr. Lynn here today. Look at her glowing smile, guys. A specialist, truly. So she's going to be telling us today 5 things that we guarantee you did not know about your teeth. So she's going to be introducing herself, but before she does that, don't forget to follow us on our social media platforms, Lifestyle Chats across our social medias, and we are proudly sponsored by the Bill Beauty app. So also don't forget to follow them on their social medias at Bill Beauty UG. So without further ado, please, I'm sure the people are dying to get to know this beauty with us today.
Thank you. That's so sweet of you. Thank you for having me today.
Of course.
My name is Dr. Lynn Esther Musinguzi Aguma. I'm a mother of 3 children, married, and very passionate about dentistry. I'm a dental surgeon by profession. I'm very passionate about it, and I love what I do.
Oh, you do seem like you exude passion.
I do. No, I really, really am. So I'm really happy that you've had me here today.
Okay, I'm excited to have you here. Teeth is something that I feel like a lot of us do not know about. And if I could just give a little bit of a backstory as to why I chose teeth, it's because when I was at uni, I went to the medical center once, and they were checking for different diseases, and I remember they were showing medical facts on the screen, and they're talking about teeth. And then they said certain things about teeth, and I'm like, I didn't know teeth affected our health so much. The way I thought teeth are just, brush your teeth, don't have bad breath. So I'm really excited for you to clear up a lot of things here for us today. So teeth are basically something that we think we all know about, but we don't necessarily have so much information on, like the nitty-gritties. So what is one fascinating fact about teeth that you could share with the people today that would have them like, this is insane? Yes.
Okay, so there are many fascinating things about teeth, but one that is very, very important is the fact that you know that the tooth is made of different layers, and the outermost layer, which is called the enamel, if you can remember,
Remember our biology
our biology class and primary science, but the enamel is the outermost surface of the tooth, and it's what gives the tooth its color. It's what gives the tooth its protection, and it's really strong. Technically, at a chemical level, enamel is actually stronger than bone.
Really?
Yes. But because enamel is exposed, it gets exposed to all the things that we eat every day, what you have for breakfast, what you have for lunch, what you have for a snack. And so it's really strong, but it does function constantly and all the time. And while you're chewing and whatever you're doing, and it does wear out, and it's prone to getting irritated by the acids, and so it loses a bit of its minerals. Now the enamel is not a living structure. It doesn't have living cells.
Oh, really?
Yes, it doesn't have living cells. They're just minerals that are calcified, so it can't regenerate itself.
Oh.
So once you destroy it, it can't automatically.
You can't bring it back.
You can't bring it back. It can't regenerate itself. So the most important thing about brushing, and I know dentists always say, brush your teeth, go on ahead and floss. But the most important thing is that when you brush, you're able to remineralize
your teeth.
You're able to bring back the minerals that it has lost, that it has lost due to function, due to wear and tear, that it has lost due to the acids that you take, the sodas that you take, any citric, anything you take.
Is this why I see like dentists on social media saying when you brush your teeth, don't like rinse your mouth with water after, because you're removing the fluoride and stuff that was in the toothpaste. So you're basically wasting what you are giving to your teeth in the first place.
It's one of the tips that you can do to retain the fluoride and the properties of toothpaste that you're using to brush. And I know for some people it's unfathomable to think that you can just leave toothpaste. But what you can do, another interesting fact on that, you know how we grew up and they would always say, oh, put toothpaste on your toothbrush. You put it under running water and then to the brush. That's wrong. That's wrong.
No.
Yes, that's wrong, because once you put it under running water, it will lather up so much in your mouth
that you've lost.
But you constantly spit it out even before it does what it's supposed to do.
Yes, that's so true.
The toothpaste is already the right consistency, and you don't need a block of toothpaste.
Yes, you need just the right pea size amount.
Just the right, so they say pea-sized amount or a smear onto your toothbrush directly to your mouth.
Don't add water. Don't.
It's the perfect consistency. You have saliva which will be able to help it soften up.
Yes.
Directly to your mouth. As usual, your dentist will always say brush in circles, 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 and then you have to clean your tongue. At the back of most toothbrushes, there are little rugged patterns.
Yes.
They'll be either in shapes like some texture there, like waves or something. So that's what you do, and you flip your toothbrush, and that's what you use to scrub your tongue.
Really, not like a tongue scraper or something.
Those also work. Those are even better. If you can get a tongue scraper, a tongue blade, different companies call it different stuff. But so that's what you use to clean your tongue.
Because the ones at the back of the toothbrush sometimes can feel quite light. Yes, they can feel quite light. I mean, for me, I use an electric toothbrush. So if you use an electric toothbrush, it means it doesn't come, okay, mine doesn't come with like the back thing. So I bought another toothbrush to use for my tongue. So is using another, like the toothbrush bristles, is that good for you cleaning your tongue?
If you're not too harsh, that wouldn't be a problem, but the blade is better. The tongue blade, it's usually made of rubber, so it's gentle, removes the plaque on the tongue, but also it gives it like a massage effect that allows the blood flow within the tongue. So that's very important. Then you can rinse at the end.
Okay.
So no water until the end. You rinse once to just get the toothpaste out. And definitely floss. You floss.
Floss your teeth.
Yeah, it's always better to floss when the toothpaste is in. If you so once you've brushed and you still have toothpaste in,
use it.
Floss, get in the middle, get in there, and then get rid of it. Yeah. So that's interesting.
Lots of fascinating facts there. I mean, I think I was doing the right thing on accident, though, but that's very fascinating. I really did not know that for example, flossing with fluoride in your mouth. Interesting facts, guys. I hope you guys are learning because there's a lot here. So some of the facts that you find out when you read about teeth is that our teeth are actually linked to our overall health, but most of us don't know that. So what is something that you would say you'd like to share with the people when it comes to how the condition of your teeth affects your overall health? Yes.
That's a very important question. There's an old dentist who say that the mouth is the window to the rest of the health of our body. So we do have a strong relationship between the mouth, the health of the mouth, and the health of the body.
Yes.
The health of the body can affect the mouth, and the mouth can affect
the body.
So we all know about our diet and stuff like that.
Yes.
But one interesting fact, and this is especially to our elderly community, is the relationship between our gum health, and our heart.
Yes, I read about that.
Yes. So the gums on the teeth have what we call a tiny pocket. The way the gums are attached to the tooth, it's just a tiny pocket there, and it can collect bacteria. So when we say brush every day, to get that plaque out, because in the mouth we have normal bacteria, but when we leave food there, it forms plaque, and then you multiply the number of bacteria into numbers that they're not supposed to. It is possible for these bacteria to actually get through the bloodstream, through your gums, especially in severe cases, and be able to move towards your blood vessels, your arteries, or your heart, or the valves of your heart. Now, this is not a very common thing. And like I said, it's common with the elderly whose immune systems
they have been compromised.
They have been compromised a bit. They've already had maybe high blood pressure. They've had a couple of diseases that have already weakened the body a bit. So make sure all your parents get their cleanings done regularly every 6 months. You too. But it can have an effect, and so we always advise all patients with heart disease or cardiovascular disease to make sure they get their dental checkups and their dental hygiene done regularly, just to prevent that.
Okay, so your gum health can cause you like a heart attack.
It can cause thickening or formation of plaques within your blood vessels and your valves that can later on lead to other conditions. So it's one of those precursors that you can just avoid and prevent.
Okay. So with regular teeth checkups.
Your regular teeth.
I know a lot of us, when I was younger, they used to take us for teeth checkups almost every 3 months, and I'd cry every time, and I'd refuse to actually go because I did not like the dentist.
Oh,
But then like I'd said, I'd gone to uni, and suddenly I was having, teeth, like thinking about my teeth a lot, and I'm like, I need to improve my teeth. And when I went in, it had been time, and she told me you need to be coming in consistently. So I really do understand now as an adult the vitality of teeth health. So as a dentist, I know you've been doing this for some time now, and you're passionate about
so much.
so I'm sure you're immersed in it. What is the craziest story that you've ever had when it comes to a patient?
Craziest. Well, I'm quite a compassionate person, so I wouldn't say I wouldn't term what I've seen or heard as crazy, but quite interesting. Dentists are really feared. Dentists are really feared, regardless of age, of build. You can have these patients really tall and big and massive. You're thinking, yeah, he's macho. But once the injection once the injection comes up, that all goes down.
It goes. He's normal now.
It just goes down. And you have to be really compassionate about that, because most of the people who have extreme fear for dentistry, it's coming from trauma that they had.
It is.
Yeah. I mean, you hear the stories of crazy stories of, or like especially older people when they were still back home in the villages, and then the dentist would put them in like a chair, which is like a dining chair, and no anesthesia, and you can hear all these stories. I'm just happy that as a country we have really, really advanced in that, and in terms of technology, but also generally the oral health care. So I think that also falls on us to just get more serious about exposing patients to what is available.
I think funny that you mentioned something like that, because I think there's a conversation that especially young people these days have. There's sometimes a sadism, let me say a sadisticness when it comes to certain medical professionals choosing to purposefully put someone through pain when they don't have to go through pain. I mean, I'll speak from personal experience, and I'm pretty sure the viewers have their own stories to share. And you guys can leave that in the comment section so that we can hear your stories and let these professionals know what they need to be doing better. But my personal experience is when I was younger, I was terrified of the dentist because they have to inject to clean. Some of us are very terrified. So they're cleaning. There's sometimes also the sound of the machines is also, absolutely terrifying. And you have this, you're taking out the plaque from your teeth, right? And I did not know that you didn't have to actually experience pain. Because recently when I went to the dentist, and it had been a time, so obviously my teeth were sensitive and all of these things, and I was terrified. And I remember this lady said, no, it's fine. So we're going to come in, we're going to first paralyze just a few sets, clean those. You come back next Wednesday, paralyze these, clean those, come back next day, paralyze, clean those. And she did. She was very patient with me, very educative, walked me through the process. So the next time I came in, because now I'm doing my daily visits because I'm taking charge, I was not scared. And so I didn't even ask for like to be numbed before she cleans. I said, I think I can do this time, because you're given a bit more confidence, because someone has handled you with patience, with care and understanding. They don't look like they want to hurt you, And I feel like I don't want to accuse anyone, but there was a certain sadism to certain professionals wanting. They know that they could alleviate the pain if they just took a bit of time, but they choose not to, and so people are scared. So I think there's a lot of misconception of the fact that you don't have to feel pain when you're doing your teeth, and now there are doctors like you who are telling people today, look, it's fine.
It's so important. So we need to, as dentists, we need to address it in two ways. One is on the prevention side. Start them early when they're young, to expose them to the dental environment, and this is to parents especially. Expose your child to the dental environment before problems come up. One interesting fact about teeth is that once the hole starts, maybe infection or a hole or anything, while it's still on the top surface, you don't feel much pain, but we can pick it up. Once you're doing your checkups, maybe your annual, biannual, or quarterly checkups, we're able to pick up the small cavities, fill it up. Sometimes don't even have to numb you. Be able to clean it out and fill it up before infection gets worse. Usually when you feel pain, it means that it has advanced so far to your nerves, or very close to the nerve, and now we have to first numb you to get you comfortable. Yes. So when you expose the children to the dental environment, the first visit should be maybe at
Expose them early.
early, yeah, expose. So maybe 3 or 4 years they're getting their cleaning done once a year, and this is to check if is there anything we need to get involved. Are they sucking their finger, and we need to stop them doing that because that will affect the form of the. Yes, yes, it does. Yes, yeah. Well, and it will affect. Can we do this? Is the jaw not growing right? And then we can affect it. So there's so many things that we can do to prevent at that point. And once the children get exposed to no pain dentistry,
Then they're going to build that practice.
then they're going to build that practice. Once they get exposed to prevention, they build a relationship of trust with the dentist.
Yes.
And therefore, when I come and I tell them, you know what, baby Mariash, maybe a 5-year-old Mariash, we have to place a filling, then they're a bit more comfortable with that, and they can understand why we're numbing them. So yeah, to be compassionate. And the older ones, yeah, definitely numbing. Once the treatment is intensive, we have to numb just to get everything to calm down.
True. I mean, a lot of people, I know you guys know that a lot of people did not even know that numbing was ever on the options list. I remember my dentist when I was younger, it said, just open. Just open. So one of the most common conditions that a lot of people experience when it comes to their teeth is bad breath, or commonly medically known as halitosis. What is something that you would share with people that might be experiencing this condition? Because I think we have a lot of misconceptions around bad breath. What could be its cause? Why is it presenting as such? Can it be cured? So please tell the people today so that we can solve an epidemic that is happening.
First of all, don't sit with bad breath. I mean, don't accept yourself to have bad breath. It's part of your daily hygiene routine. But sometimes you can have bad breath whereby you're brushing your teeth and you're doing everything that you need to do, and you feel that your breath is not fresh. It's not fresh. Or by midday, something is things have gone astray a bit. Don't accept, because bad breath usually represents so many things. There's so many things that can cause. We typically say back at the practice that we have 5 causes of bad breath, and 2 of them are not in the mouth. So you can get bad breath. Yeah, you can get bad breath from your stomach. I'm going to start from the listing part. You can get from your stomach. If you have bad gas building up in your stomach, and you need to just check that, and you're belching a lot, and that gas can just retain
Itself in the air.
in the air, yes, in the gut and coming all the way, and that can always come up as bad breath. So make sure you're taking care of yourself. You're healthy all round. Your gut health is okay. You're eating right. If you're not comfortable with certain foods in your stomach,
Lactose intolerant.
the stomach will tell you. The stomach will tell you, just avoid that, or have a consultation with a dietitian. So the other is the lungs, and yes, and this is very common also in children.
Mouth breathers.
Yeah, chest infections. Once you have chest infections, you have bacteria that are accumulating, or at the back of the throat, and that can,
tonsils.
Tonsils. And in your sinuses, and this can also cause bad breath. So in the mouth, there are typically 3: the teeth themselves, having a hole, retaining food, and sometimes, when we're cleaning out the teeth, we can find, tiny seeds in the teeth.
Tiny seeds.
Yes, let's say a tomato seed, a guava seed, and you find it in the tooth. Now, the funny thing about these seeds is that they block food from getting farther inside, so that you can feel the pain. So many times you don't even know you have it. Yeah. So always have your dental checkups done. So, and the next one is the gums, and the gums can form plaque, can collect plaque, like we talked about.
It's the gums that collect plaque, not the teeth itself.
So the plaque is attached to the tooth. It's just like sitting in the pocket.
Oh yes, that
little corner, right? Yes. And so when you brush on the tooth surface. So the plaque inside the gum, you may not be able to get
That's
inside.
That's why you always have to go in for that cleaning.
And then you have your mouthwash where you can gargle and swash your mouthwash around. And so the plaque can form something called calculus. That one is hard. Even your toothbrush can't take it away. So we have to scale it off. And that's when you come in for your scaling and your cleaning. Yeah. So you have to scale it off. And the last is the tongue. The tongue. Many times we forget about cleaning up the tongue, especially in children. When they're having what we call mixed dentition, coming from the baby teeth, losing the baby teeth, to the permanent. So that's maybe 5.5 all the way like to 10, 11. Everybody's different. But during that time, because they're having wounds in the mouth, a baby tooth has come and they're coming in. Sometimes they're brushing their teeth very well and they're not cleaning their tongue. So if your child has bad breath, don't panic. Just first clean the tongue, get a tongue blade, clean the tongue, and then see. And then for an adult, please go have your dental checkup, have your dental cleaning done every 6 months. And during your dental cleaning, we'll do your dental check x-rays to check in between the teeth where our eyes cannot see, because we can't see everywhere. We'll see on the surface, but we need to see in between. Okay, have your dental x-rays done at least twice a year to just check everything is okay. And then just maintain your oral health and just be healthy all round. Yeah.
So I don't know about you guys, but I'm definitely switching my dentist to here. So please tell these people where they can find you so that we can have less traumatizing experiences at the dentist.
Yes.
Yeah, so please let us know your socials, where we can find you, where you do your practice.
Yeah. So on my socials, I'll start with my Instagram. I'm Dr. Lynn, my dentist, and you can always find me on social media. I will always give tips there. I will share with you my number. I'm always posting on the status quick tips that to help you. And then I work at Pan Dental Surgery, where Pan Dental Surgery, where you can find us. Yes.
Okay.
Yes.
Thank you so much.
You're welcome.
This has been not only a teaching moment, but it's been a healing moment.
Yeah.
Because I'm sure many people understand that we need a good relationship with dentistry.
Yeah.
It's very important. So thank you so much for educating us and continuing to educate us. Definitely we shall be visiting Pan Dental to have a checkup and to have a cleaning. Guys, thank you so much for making it to the end of this video. I hope to see your stories in the comment section so that we can share with the professionals. Don't forget to like, comment, subscribe, and share this video with your friends. And let us know if these are conversations that you're interested in. It's been Ashley
and Dr. Lynn.
Thank you guys so much. See you guys next time. Ciao.